Hello friends, in continuation to our previous classes, in today's tutorial we will be discussing about the rest of the endocrine glands, about gonadal glands. Gonadal glands. Here, reproductive organs are considered as the gonads, and they also act as endocrine glands. Actually, they are considered as cytogenic glands because they have the ability to produce both the sperm cell, the say for example germ cell says sperm in case of testis, or ovum in case of ovaries, at the same time sex hormones, that means hormones in general. Okay, since they have the ability to produce both hormones and the germ cells, they are considered as the cytogenic glands. Cytogenic glands. And in case of males, they are considered as testes. In case of females, they are ovaries. In testis, there are certain cells called Leydig cells, particularly interstitial cells of Leydig. They secrete testosterone. In previous classes we have discussed about different pituitary gland hormones, and there we have discussed about luteinizing hormone or interstitial cell stimulating hormone. This luteinizing hormone LH will stimulate the interstitial cells of Leydig in testis of males to secrete androgen, and the principal androgen is testosterone. Particularly, that means the components involving in the secretion of hormones are interstitial cells of Leydig. Say for instance, a rough sketch. So this will be testis. And the seminiferous tubules, and they locate, that means the location of interstitial cells of Leydig is interseminiferous tubular spaces. Interseminiferous tubular spaces. Interseminiferous tubular spaces. They secrete androgens. Regarding the basics, say the testes are located in the scrotal sacs, that means outside the abdomen. It's about basics, okay? Basics then, and they secrete androgen. The principal androgen is testosterone. Is the important secondary sexual hormone, and this androgen, that means are essential for the development, the maturation, the functioning of male accessory sex organs. Male accessory sex organs. Male accessory sex organs like epididymis, vas deferens, seminal vesicles, prostate gland, then urethra. These are all considered as male accessory sex organs. For the development of the same, androgens are essential. And we already discussed about adenohypophysis hormones now. Along with follicle stimulating hormone, these androgens stimulate spermatogenesis. It stimulates spermatogenesis. The most important function is libido or sex drive. These androgens affect the central nervous system in males. That means with respect to sex drive, what we call libido, what we call sexual urge. The sexual urge in male is caused by the effect of androgen on the central nervous system, and the phenomenon is considered as the libido. Okay, and these are responsible for low pitch voice, what we call masculine voice, low pitch voice. These are all about how, that means testes act as endocrine glands. That means apart from sperm production, that means since they are considered as cytogenic glands, they also produce certain sexual hormones, the androgen, principal androgen, testosterone, and they are the important functions. With respect to ovaries, they secrete two kinds of hormones, estrogen and progesterone. Unlike testes, ovaries are located in the abdominal cavity. They are also considered as the cytogenic glands because one egg will be released per one menstrual cycle. At the same time, they also release estrogens and progesterone. This is very important. No, estrogen. Just like testosterone, estrogen is essential for the development of female sex organs. No, female secondary sex organs. Female secondary sex organs. The same component here also. It also controls the sex drive. That means sex control, sexual urge, and also high pitch voice. And estrogen is also essential for the development of mammary glands. Development of mammary glands. The thing is, previously we have discussed about luteotropic hormone. This luteotropic hormone is essential for the development, that means enlargement of mammary glands. At the same time, they are also essential for corpus luteum. And this development of mammary glands, estrogen also had their role. And this progesterone is essential for the development of alveoli in the mammary gland. That means alveoli are nothing but sacs which stores the milk. Here it's an integrated action of different female hormones. Let's say the prolactin is for initiation, sustenance of lactation, and also enlargement of mammary glands. At the same time, estrogen also has a role in the development of mammary glands. Whereas progesterone is essential for the development of alveoli. That means for storage of milk. Whereas the oxytocin we have discussed now, it is essential for the ejection of milk. That means the prolactin, the estrogen, the progesterone, they all in the integrated way, they're responsible for the female issues. That's how they affect the female characteristics. Then regarding progesterone, it will be releasing by here. It is estrogen released by the ovarian follicles. And this progesterone is released by corpus luteum. Corpus luteum. We have discussed about corpus luteum now. Corpus luteum means here, just like in case of male, luteinizing hormone is responsible for leading, that means stimulation of leading cell to synthesize androgen. Here in case of females, luteinizing hormone is essential for ovulation. That means the matured secondary oocyte should rupture. That means should come out of the follicular clutches for fertilization process. And it is called ovulation. After it is done, the ruptured graphene follicles, what we call tertiary follicles, will convert into a temporary endocrine gland, what we call a stereoideogenic cluster of endocrine glands, temporary endocrine gland, what we call corpus luteum. And this corpus luteum will secrete progesterone. And this corpus luteum maintenance is by prolactin. This is very important. Different hormones, how different hormones play a role in female characteristics. And this corpus luteum is maintained by the prolactin, and the ovulation is done by luteinizing hormone, and this corpus luteum secrete progesterone. This progesterone will prepare the uterine. That means for implantation of blastocysts, what we call pregnancy maintenance. If there is no pregnancy, that means there is no fertilization, this corpus luteum will convert into corpus albicans. No fertilization, it will convert into corpus albicans. This is very important. If there is fertilization, then the pregnancy will maintain. That means the corpus luteum will secrete progesterone, and progesterone will maintain for that uterine wall for implantation of blastocysts, and all that will continue. If there is no fertilization, the corpus luteum will convert into corpus albicans. I already discussed now. It is involved in the formation of alveoli. Alveoli which store milk. It's after delivery, and this progesterone hormone is essential because the milk has to store. That's how different female characteristics are controlled by estrogen, progesterone, and prolactin hormone, and also luteinizing hormone. It's all about gonadal glands. Testis in case of males, which is extra abdominal. Ovaries in case of females, and in rest the androgen in case of here the estrogen and progesterone, and there are different characteristics that are controlled by the gonadal glands. Okay. Then the next important endocrine glands are kidney. The most important thing is endocrine gland. Generally, the principal role is to secrete hormones, but there are certain organs which fundamentally they are not endocrine glands, but they do secrete certain hormones. Say kidney, say heart, say gastrointestinal tract. Say heart, for example. Say actually non-endocrine glands which secretes hormones. Say the heart, the kidney, then the gastrointestinal tract. Gastrointestinal tract. First, the heart. Heart also secretes an important hormone called atrial natriuretic peptide or atrial natriuretic factor, which the exact component involving in the secretion, that means synthesis and secretion of this ANF or ANP, is atrial myocytes. Atrial myocytes will secrete atrial natriuretic factor or peptide, simply called ANF or ANP. Atrial natriuretic factor or atrial natriuretic peptide. It's a peptide hormone, the word it implies. It is involved in dilation of blood vessels. Dilation of blood vessels. Then lowering of blood pressure. Lowering of blood pressure. Say, it is also it decreases the reabsorption of sodium in the renal tubule. When if there is a reabsorption of sodium in the renal tubule, it will increase the blood pressure. Since it acting, that means the principal function of this hormone is to reduce the blood pressure, it decreases the reabsorption of sodium in the renal tubule of the kidneys. That's how it reduces that means lowers the blood pressure. The principal role is dilation of blood vessels. It's about atrial natriuretic peptide. Atrial in the sense refers to atria, the right and left. The word it implies that atrial natriuretic factor or peptide. Then kidney, it secretes erythropoietin. Erythropoietin, particularly juxtaglomerular cells. Juxtaglomerular cells of nephron will secrete erythropoietin. Erythropoietin is hormone. The word it implies, it induces the red blood cell formation. Erythropoiesis. 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 What exactly erythropoiesis is? It controls the red blood cell formation. How? Because it regulates the differentiation and the proliferation of the erythroid progenitor cells. This is very important. In bone marrow. How it regulates differentiation and proliferation of erythroid progenitor cells. Erythroid progenitor cells. That's how they control RBC, that means erythropoiesis. The word implies simply erythropoietin. That means by juxtaglomerular cells. In gastrointestinal tract, the mucosa, no different layers are there now. Mucosa, submucosa layer. Here the mucosa of GIT, simply called mucosa of gastrointestinal tract, has different cells that secrete different peptide hormones. Say for example gastrin, the secretin, then cholecystokinin or pancreozymin, then gastric inhibitory peptide. These are the major important peptide hormones secreted by the mucosa of gastrointestinal tract. Here gastrin, gastrin, the word it implies, it stimulates the gastric glands. For what? It stimulates the gastric gland to produce HCl and pepsinogen. HCl and pepsinogen. Gastric gland. The thing is, peptide bonds are the most powerful biomolecular bonds. To break the peptide bonds, there is a requirement of concentrated environment. For that, HCl around pH 1.5 is essential, and that is why the HCl is essential for maintenance of concentration medium, so as to break down the peptide bonds present in the protein, and the action is done by an enzyme called pepsinogen. Of course, it is in inactive form. Then it will come into pepsin. For all this process, it has to secrete this HCl and the pepsinogen from the gastric gland. So this is an essential hormone, particularly important in digestion. It is very important. Gastrin. Okay. Then secretin. Secretinin means it stimulates the exocrine part of pancreas to release water and bicarbonate ions. Stimulates the exocrine part of pancreas to release water and bicarbonate ions. Then cholecystokinin pancreas is very important. This cholecystokinin pancreas is essential for stimulation, that means for contraction of gallbladder. We know that gallbladder that stores bile juice. It stimulates the gallbladder, that means contraction of gallbladder, the bile juice come out of it. The bile juice contains the essential compounds like bile salts, say glycocholates and thyrocholates of sodium and potassium, and bile pigments, bilirubin and biliverdin. They are nothing but the pregnant product of hemoglobin of the old RTC. And this is the duty of cholecystokinin. Why it is called pancreasemia? It also stimulates the pancreas to release digestive enzymes like trypsinogen. This trypsinogen is one of the important digestive enzyme releasing from the pancreas, and it is under the stimulation. That means it is stimulated or induced by the cholecystokinin or pancreasemia. Okay, that means contraction of gallbladder, then pancreatic enzymes. Gastric inhibitory peptide. Let's say the word implied, it inhibits the gastric glands. That means so that it cannot execrete gastric juice. The same, the gastrin inhibitory peptide inhibits gastric glands. So these are the different hormones secreted by the mucosa of gastrointestinal tract. And here, in case of kidney, it is erythropoietin inducing erythropoiesis. In case of heart, this atrial natriuretic peptide or factor that is essential for dilation of blood vessels and lowering the blood pressure. So there are different non-endocrine glands that have the ability to secrete hormones. Apart from these, there are two other endocrine glands which are essential. They are also important for maintenance of all. That means different physiological activities. Thymus and pineal gland. Thymus and pineal gland. Here, thymus secretes thymosin. Thymosin, it is one of the important hormone which strengthens the immune system. Where thymus is present. Thymus gland actually is a lobular gland present just above the heart and aorta beneath the breastbone. This is present just above the heart and beneath the breastbone. This strengthens the immune system. How it strengthens the immune system? Because it is important in the differentiation of T lymphocytes. Differentiation of T lymphocytes. We knew that T lymphocytes, there are two kinds of immune system. In the previous class we have discussed now. Cell-mediated immunity and the humoral immunity. Cell-mediated immunity brought on by the T cells. Here the T cells, that means actually they should come down to CTL, cytotoxic T lymphocytes, which have the ability to attack, that means to defend our body. So for that, differentiation is most important, and that means promotion of cell-mediated immunity, and this will be done by thymosin. It also promotes production of antibodies. That means it also stimulates humoral immunity. Antibodies, humor means body fluids, humor means antibodies, and it also promotes here both angles, the cell-mediated immunity by definition of T cells and production of antibody leads to humoral immunity. But the thing is, thymus gland actually it's small in size when we gave our birth, but later it will be gradually increase in size up to puberty. And at puberty, it will attain the maximum size. And when the adolescence starts, this will gradually begin to shrink down. That means it gradually shrinks. And ultimately, it gets degenerated in case of old age people. That is why, in case of old people, there is a weakening of immune system. It is believed that it leads to aging as well. So, this thymus gland is an essential, fundamental pillar for strengthening immune system. Then pineal gland, epiphysis cerebri. epiphysis cerebri. It is present in the dorsal surface of the diencephalon. Diencephalon is one of the part of forebrain or prosencephalon. Dorsal surface of diencephalon. It's cyclic melatonin. Melatonin is an hormone that is essential for maintenance of our circadian or 24-hour daily cycle. It's like, for example, our daily cycle, when sleep wake cycle or body temperature, these are all different activities of circadian rhythms. That is come under the crown of circadian rhythms, or diurnal rhythms. So it is simply called circadian rhythms. And these circadian rhythms will be controlled by melatonin. How it controls circadian? Actually, there is a suprachiasmatic nucleus, what we call, SCN, suprachiasmatic nucleus present in hypothalamus. This is considered as biological clock. Here melatonin affects the SCN. How it the first logical question will arise: how melatonin affects the circadian rhythms? Because it affects the suprachiasmatic nucleus of the hypothalamus, which is considered as the biological clock. Since by controlling the SCN, it regulates the circadian rhythms. This is how the melatonin secreted by the epiphysis, or that means epiphysis cerebri or pineal gland, regulates the circadian rhythms of our day-to-day activities. Okay, it's about thymus and pineal gland. Okay, so with this we have discussed major endocrine glands, their effects and functions. The main role of these endocrine glands is to bring down homeostasis by its dynamic effect. If something happens like under secretion or over secretion to the normal levels of hormone, it leads to disorders like hyposecretion or hypersecretion, which have adversarial consequences. So that means endocrine disorders. We will be discussing about certain important endocrine disorders. These are all important in maintenance of homeostasis. Endocrine disorders. Say, particularly, we'll start with growth hormone. Growth hormone, somatotropin. Say, there are three issues: gigantism, acromegaly, dwarfism. Simply dwarfs or midgets. There are three disorders connected to somatotropin. If, for example, there is excess secretion of somatotropin before the puberty, that means hypersecretion before puberty, it leads to gigantism. Gigantism means over secretion of skeleton. That means increase in the height is gigantism. If this happens during childhood, that means under secretion, hypo. It leads to dwarfs or midgets. That means the growth will be retarded. The thing is, though they are dwarfs, but they are mentally and sexually they are normal. Only thing is their height gets affected because of hyposecretion of somatotropin. Imagine it's the same, that means hypersecretion of somatotropin during adults, hyper. It leads to acromegaly. Acromegaly is like gorilla-like appearance. What happened? The jaw bones, particularly, the jaw bones become elongated. The hand bones, the feet bones. Because of this elongation of different bones present in our body, it gives the appearance of a gorilla-like. That's why it's called acromegaly. It is hypersecretion of somatotropin in adults. So these are about different disorders of somatotropin. Then the next one is the thyroid gland. There's three things, exophthalmic goiter, simple goiter, cretinism, myxedema. Thyroid gland we have discussed already. It is essential for BMR, basal metabolic rate. Okay, here when there is a hypersecretion, hypersecretion of thyroid hormones, hypersecretion of thyroid hormone leads to exophthalmic goiter. The most characteristic feature is protrusion of eyeballs. Protrusion of eyeballs. Protrusion of eyeballs. Whereas simple goiter because hypo. Why hypo? Means when there is inadequate iodine supply in the diet, it leads to formation of a goiter. That means enlargement of the thyroid gland is a goiter, simply called simple goiter. That means hyposecretion of thyroid gland leads to simple goiter. Hyposecretion leads to simple goiter because of iodine. Full iodine deficiency. That means iodine deficiency now. When the thing is, when just imagine there is a hyposecretion, but the concerned woman is a pregnant lady, that leads to cretinism. You know, cretinism means the growing baby will get affected. It is called cretinism because of hyposecretion of thyroid hormones. And the most characteristic is physically and mentally retarded. Physical and mental retardation. That means low intelligence coefficient, stunted growth. You know, these are all resulted if it is untreated. What we call congenital hypothyroidism. Congenital hypothyroidism. Congenital hypothyroidism. If it is untreated, leads to cretinism. The child will become with low IQ. So that we should have a sufficient iodine supply for that. So proper healthy diet is essential for that. Okay. Then after that, myxedema. You know, if in case of women, that means adult women, if there is a hyposecretion, undersecretion of thyroid hormones, it leads to imbalance or irregularities in their menstrual cycles. That means in case of adults, undersecretion leads to myxedema. The features like resistance, that means low resistance to, that means low tolerance to cold, puffiness of skin, that means puffiness of space, dry skin, etc. These are some of the symptoms of myxedema. The most important thing is dry skin, low cold resistance, tolerance, and puffiness are some of the important symptoms of myxedema. If this undersecretion is in case of adult women, leads to irregularities in menstrual cycle. So these are all different thyroid hormone disorders. Then the most important things, adrenal gland. Adrenal gland. There are two things: Addison's disease and Cushing syndrome. Addison's means hyposecretion of glucocorticoids. We have discussed now adrenal gland hormone, adrenal cortex, glucocorticoids released by the secreted by the zona fasciculata, cortisol, hydrocortisone, which is what we call stress combating hormone. And these glucocorticoids are considered as a life-saving hormones. Hyposecretion of these glucocorticoids leads to reducing weight and weak muscle, and that affected individual will lost the ability to face the stress, because cortisol is stress combating hormone. Since it is under secretion, he or she lost the ability to face different stress conditions. So this is a report that leads to Addison's disease. That means hyposecretion of glucocorticoid leads to Addison's disease. Whereas hypersecretion of glucocorticoids leads to Cushing's syndrome. Hypersecretion, excess secretion is like the characteristic is like round face, like it's like moon face, what we call, or the development of, it's like on the back it's like Hulk development. Just like imagine for ox. That means it is because of redistribution of fat and muscle protein breakdown. It's because of redistribution of fat and breakdown of muscle protein. Because it's like hump appearance and moon face, like the face will be round like moon, and pendulous abdomen. These are different characteristic features of Cushing syndrome. That means because of hypersecretion of glucocorticoids. Whereas if it is hyposecretion of glucocorticoids, it leads to Addison's disease. Okay. Apart from these two, there are other disorders. You know, hypo and hyperparathyroidism. Parathyroid glands, no? Hypo, parathyroid glands. Parathyroid glands. Hypo and hyper. Hypo leads to, tetany. The thing is, prolonged muscle contraction is a characteristic feature of tetany. It is because of hypo, under secretion of parathyroid hormones. If it is hyper, we already discussed the activity of parathyroid hormone is like bone resorption, increase of blood calcium level, what we call hyperglycemic hormone. Sorry, hypercalcemic hormone is the name designated to parathyroid hormone. Since it is the hypercalcemic hormone, if it is released in excess, that means secreted in excess, it leads to bone decalcification. Excess bone decalcification leads to random, that means it's like higher quantity of calcium in the blood, and this leads to bone deformities and eventually breaking down of bone deformities. At the same time, calcification in kidneys, what we call stone formation in kidneys.